The theme of this session is Making Hospitals Transplant Friendly. As the previous speaker, Ms. Roberta Francis, has indicated, the National Organ Transplant Unit has assiduously over the years attempting to raise our deceased donor pool. And we have done this by trying to target the public as well as potential kidney recipients, of whom we know there are many in Trinidad and Tobago. And we have done this through public awareness programs and public health campaigns. This workshop represents an additional arm in our strategy. The National Organ Transplant Unit is seeking to raise awareness of transplantation in our hospitals and as well among the hospital staff and anybody else who is interested about this whole process of transplantation from a deceased donor.
The task before us is to involve more citizens in responding to the call to become organ donors. At present, we are currently relying on living donors, but we need to expand and involve and incorporate a deceased donor supply. Giving the gift of life after death is indeed a remarkable act of kindness. In our hospitals, there exists the potential of providing donated organs to those who may be in need of this gift of life. We thus recognize the important role which must be played by healthcare professionals who may not be directly involved with organ transplantation. Through this workshop, we are enabling healthcare professionals to become organ donor champions. These are healthcare workers who work in intensive care units, operating theaters, accident and emergency departments. They will be trained to understand the process of organ donation and transplantation so that they can better facilitate and encourage organ donation from the families of deceased persons at hospitals. We'll also be involving our hospital administration and other policymakers, such as the chief executive officers and senior management in our regional health authorities, to ensure these organ donor champions have the supportive environment to perform this much needed function. I'm therefore very happy that all regional health authorities are represented here today at the level of their chief executive officers and hospital medical directors, which demonstrates the commitment. Making our hospitals transplant friendly is just one of the many steps in our efforts to increase the organ donor pool. Colleagues, there are a number of sensitivities we need to take into account when it comes to organ donation and transplantation. An example of this is that whereas persons themselves might pledge to donate their organs, the family of the potential donor is always consulted for final authorization before removing the organs from the donor. The implication in such cases is that where time is of essence, the family is often unprepared to make such a decision. One can understand how a family might feel soon after the death of a loved one. The mere thought of removing organs from their body is often unthinkable at that time. Therefore, we need to work together to ensure that the appropriate and effective procedures are implemented at our hospitals to properly facilitate that donation process. Empathy, understanding, sensitivity, and tact are essential when communicating with the bereaved family, especially in a culture like Trinidad and Tobago. Quality customer care and service are critical at this difficult time.
Our visit here this week is really an opportunity to share and to learn. We come with a fair degree of experience in our world in Southern California and Los Angeles, and we've visited a number of other donation programs around the world, but no two worlds are the same, and we all have an opportunity to learn from one another about how to do our work better in saving lives. We will share a number of principles and practices and processes, starting with an overview today, and then for the next week, Maria and Renee will spend a great deal of time with a number of you, one-on-one, going through further training programs and as groups going through further training programs based upon our experience here and working with the Transplant Procurement Management Program out of Barcelona, Spain, as well as the Association of Organ Procurement Organizations in the United States, and a variety of programs worldwide like the ISODP, International Society for Organ Donation, that was mentioned earlier. And hopefully we will have that to share. But hopefully we will also learn from you, and for those of you who are here today, and for those of you who are with Maria and Renee the rest of the week, we very much appreciate questions and comments and feedback because we never walk away without learning more about how to do the job of helping families make something good come from a loss and save lives. So we very much appreciate that opportunity.